I found that I'm HIV positive. It was not easy to accept that, because when I was diagnosed HIV positive, I didn't get a counseling. I was just told that you are HIV positive and you are going to die. I was very sick, having a diarrhea, losing weight. And all the time when I wake up in the morning, I decided to go back into my bed and sleep again. It was difficult to me to do everything, to wash myself, even my clothes, and to cook for me, and to work, and to walk a long distance. So I contacted my doctor, and my doctor told me to use ARVs so as to boost my immune system.
We see before we started here in Kayelitsha providing antiretrovirals, nobody in South Africa in the public health service had access to these antiretrovirals. If you were on a medical aid, the medical aid might pay for them, but in the public health, people couldn't get these medicines.
I wake up early in the morning, I take a train by 20 to 5, I go to Epping and buy this stuff, selling for the people.
We're providing antiretrovirals to people with HIV who need it. We've got some criteria in terms of the medical condition of the patient. For instance, the CD4 count must be lower than 200. For us, it is clear that there's no benefit of starting the antiretrovirals while the virus is still in an early stage. We use blood tests to monitor the development of the disease, and the most common test used is the CD4 count, which actually measures the strength of the immune system. And when we see that the CD4 count goes below 200, we can basically see that this is an indication of the virus getting stronger, and that is the stage at which we recommend patients from starting with antiretrovirals.
I was very sick because my CD4 count was 174. My viral load was 240,000.
Abantu abaseKhayelitsha abazityayo bazitya kakuhle futhi medically they responded very well, because most of them they are doing exactly what is expected to do xa ngaba you are on ARVs. We look at the compliance. One, we are dealing with abantu apha who are illiterate, who cannot read, who cannot write, but who are doing it in such a manner that you wonder ukuba nyani ingqondo yemveli uyabona iyasebenza. One, as long as you explain the whole thing thara emntwini, then umntu uyayenza.
I was taking AZT, 3TC, combination and nevaropin. Since I've started on ARVs, I'm feeling okay. I didn't have any side effects since I've started last year.
From the pharmaceutical company side, we often hear the argument they don't want to come down with the prices, because even if they would give the medicines for free, African governments don't know how to use them. There's not the infrastructure. And we basically proving that the infrastructure exists. I mean, we didn't add anything to this clinic except the know-how. It's a primary care health clinic like you find in any township, and these medicines can be given under these circumstances. In fact, we get very good results under these circumstances. Yes. We don't have to treat all people immediately. Only the people that are sick with HIV have to be treated. However, by treating those people, we actually save money. This has been proved in Brazil, where 100,000 people are being treated with antiretrovirals, and we can show it with our own experience here in Kayelitsha. Because when we don't treat people, we have to refer the person often to hospital, where they have to be hospitalized, and where hospitalization is much more expensive than the medicines that we use. For instance, one night sleeping at a hospital costs about 500 rands, and people get many infections if we don't treat them with antiretrovirals. By using antiretrovirals, we have cut down the rate of TB by 85% amongst our patients. And we've cut down the incidence of opportunistic infections, of how many times the person gets an HIV-related infection, by 67%.
Counseling is the best medication, even to myself. I become well when I say other people who are HIV positive, I didn't know that. I thought that I was the only person who is HIV. So I met other people who are HIV, and then I became well, and they are beautiful, as I'm beautiful now.
Ekuqalekeni mandithi ndithi uba bandicacisela ngoba ndazazi uba ndingumntu HIV positive, bandikhansila kuqala, then ndagula, bandixelela nge-treatment ukuba manditye kanjani, ndalandela ngokwemithetho yabo ke kuba kude kwangoku ndangulo mntu ndinguye ndiphilile ziyimiqathango yabo.
Kwenzeka ntoni xa ndithe ndayilibala noba idose eyi-1 ndimane ndilibala laa dose iyi-1 ndingaseli ngalaa ndlela bekumele uba ndisela ngayo? Yintoni eyenzekayo? Zeziphi iziphumo efuneka ndizilindele?
Xa ungayithathi kakuhle itreatment yakho ngendlela efanelekileyo, funeka ulindele ukuthi i-CD4 count yakho iyehla, and isenokuhambe ihambe ethubeni itreatment ke ngoku ingasebenzi emzimbeni, iye kusebenza uphinde uqale ekuqaleni ugule kuba ivirus yenyukile.
Uba usela ngo-9 sela ngo-9, uba usele ngo-9 wayosela ngo-1, so azizuqhuba ngolo hlobo kumele lwasiqhube ngalo.
How do you feel when somebody passes away due to the side effects of ARVs?
When you have got side effect, you have to go to the doctor immediately so that it can be treated so soon, and it is treated. And even myself, I had only rash on my arms. That was the only side effect I had.
At our clinics in Kayelitsha, we can only treat a small number of people at the moment. We've got funding partly from Doctors Without Borders, partly from the Western Cape government for providing antiretrovirals for 400 patients. Seen as a pool of 4 to 5 million people living with HIV in South Africa, it seems like just touching a drop in the ocean.
Kaloku ezi antiretrovirals zezabantu abangakwaziyo ufikeleleka kumgangatho othile wemali. For instance, umuntu mhlawumbi ongazukwazi ukubhatala, ongaphangeliyo. Xa ngabe uyaphangela noko asikwazi ukunika mhlawumbi nomvuzo wakho uthe xhaxha unokwazi uba ne-medical aid.
I think the government should think about the people who are HIV positive and who are not working. If you are HIV positive and you are not working, you cannot manage the ARVs, because before you take your medication, you're supposed to have enough food.
You have to start with pilot sites like this one in every province, building up a know-how, getting to treat some people, and then obviously within the next 2-3 years we should move towards national rollout of antiretroviral programs. I think we should put our investment now into training nurses, into training doctors in proper HIV management, and I think that's where the big investment must go at the moment. That's what I think the pilot sites are important for, to use them as a training school for your health professionals.
Other people think that when you are HIV positive, you're supposed to sleep in your bed. I don't think it's like that. I'm on the way to my dreams now, because when I was at school, I was thinking about a business, to be a businessman. I'm doing fine in my job because I'm fit and I'm doing everything.
People change their attitudes, and I mean that's an important part of an antiretroviral program, is to change attitudes and to get people enthusiastic about there's hope with HIV. It's not just despair. We don't need, to invest in home-based care. We don't need to invest in hospices. We need to invest in proper clinics. We need to train our nurses to treat HIV.
My life really changed because I'm feeling okay and I'm strong like other people.